Hi, I'm Dr. Lisa, an infectious disease doc and a medical epidemiologist. Did you hear the WHO declared monkeypox a disease of international concern? Well, what does that mean? Basically, it's a way for us to put doctors and community members on alert to be looking out for monkeypox, because if we're looking out for it, we can identify it and contain the spread of monkeypox. So what is monkeypox? Monkeypox was discovered in the 1950s in macaques, which is a type of monkey. So that's how it got its name, monkeypox. Monkeypox is also a cousin to smallpox. They're related, but they're not the same. Monkeypox causes a much milder disease.
What are the signs and symptoms of monkeypox? Now remember, monkeypox can spread by skin-to-skin contact, and even in some cases through respiratory droplets. With that being said, most patients begin experiencing symptoms after a few days of having contact with someone else who has had monkeypox. And those symptoms include feeling feverish, having body aches, also having swollen lymph nodes. Now, after a few days, the pock marks start to come forth. And those oftentimes look like pimples. It can also look like fluid-filled blisters. And while there may not be a rash in multiple places all over the body, some patients may experience a singular lesion or a singular pox mark.
So what do we know about this monkeypox outbreak? The cool thing is, a group of researchers and clinicians from Europe, the US, and Canada combined the information they had on 528 cases of monkeypox and published it in the New England Journal of Medicine. So now we have some idea of what the range of signs and symptoms were and how people were presenting with monkeypox. 95% of the cases had a rash, and the rash doesn't present the same way in every person. 62% had a fever. And the good news is only 13% were hospitalized, and they were hospitalized for complications related to their brain, the lungs, the eyes, and some of them had secondary bacterial infection, which means you can get an infection on top of the infection you already had, and it might require antibiotics, which cause you to be in the hospital.
And more recently, we're seeing more cases of marks or rashes on the genitalia or in the anus.
And those symptoms can be confused for other sexually transmitted infections, so you have to be thinking about monkeypox.
So if you notice a rash that's abnormal, and you especially have symptoms of fever, it's important to speak with your primary care provider.
Do you have more questions for us about monkeypox? Leave them below. I'm Dr. Lisa, and I'll see you on the street.